If you're in an accident, will your insurance cover the costs? What if you have to be air flighted to the hospital? An Austin News investigation found two local families who faced those questions and are now stuck with $16,000 bills. All new at 6. KXAN's investigative reporter Nancy Wilson shows us how a growing industry of private air ambulance companies is adding a new twist to the healthcare debate.
Well, it was late at night, probably after 11 o'clock, 11:15.
That's the night last June when Oscar Vaz's phone rang.
We get a call from the camp saying that our daughter had an accident and that she was being transported to the hospital in an ambulance.
The Vaz's 12-year-old daughter fell and bumped her head at Balcony Spring Camp in Marble Falls. She was headed to Dell Children's Hospital. They were relieved to hear her injuries were not significant. In fact, doctors discharged her the same day.
There was no trauma, well, no extended trauma to her, and that she could go back to the camp and participate in pretty much any activity she wanted.
Good news for the family, but the news that followed was not. Because his daughter wasn't seriously injured, Vaz's insurance company refused to pay for the helicopter transport, saying the ride was not medically necessary. Now Vaz is stuck with the bill, $16,335. Medical helicopters can save lives, but more and more consumers are finding that it comes with a high price, a price their health insurance may not cover. A representative from the company that flew Vaz's daughter says consumers need to be aware of what their insurance covers and consider other options to protect their family. His company, like many other private air ambulance services, sells annual memberships. If a member needs to be air flighted, the company agrees to accept whatever insurance company pays. But Heidi McCord learned that even that carries no guarantees. McCord lives in Kerrville. In 2007, she paid $150 for a 3-year membership in Air Evac.
And we bought it specifically because we live in a rural area. I travel to and from town, which isn't far, but I know this is a very dangerous highway out here. And I just felt it could be something that we may need.
And sure enough, last December, she did.
And I was involved in a motor vehicle crash very close to my home.
A serious crash with multiple vehicles.
They had told me that I was going to need transportation by helicopter.
Despite her injuries, McCord says she was alert enough to tell paramedics.
I am an Air Evac member. I have a membership on Air Evac. I will only go on Air Evac.
A helicopter did fly McCord to the hospital.
I'm thinking the entire way down there, on my way to San Antonio, praise, praise, praise. For once in my life, I have done something ahead of time that is going to benefit me, that I am not going to be saddled with this bill.
But the bill later showed it wasn't an Air Evac helicopter, but one owned by San Antonio-based Air Life. And now, despite her membership with Air Evac, McCord owes the other company more than $16,000.
I'm in shock still. Had I known they were putting me on the wrong helicopter and that it would cost me $16,000+, I would have been clawing my way out of there.
Healthcare advocate Blake Hudson says consumers are sometimes left in a vulnerable position.
It's perfectly reasonable for a consumer to expect that their insurance will cover them in the event of an accident, including the ride to the hospital that's deemed medically necessary. What we have here is consumers being squeezed between an insurance company with a low or maybe no reimbursement rate and a provider demanding payment for a high-cost service. Consumers may be left with tens of thousands of dollars in bills.
And that makes Heidi McCord angry.
And the average person cannot and will not be able to afford this, and their insurance will not pay for it, and they will come after you and haunt you and take you to collections and make your life miserable to pay these exorbitant amounts when you've already have had one catastrophe in your life. I am extremely angry.
Oscar Vaz is too. He's stuck for a bill for a service that he says didn't even save time getting his daughter to the hospital.
At the time they called for an air ambulance, if they just started driving, they'd have been to Dell Children's Hospital a good 10, 15 minutes, 10 minutes easily before the helicopter ever got there.
For families like the Vaz and the McCords, there's little recourse. Unlike county-owned Starflight, where you can appeal by going before the Travis County Commissioners, private air ambulance companies cannot be regulated by the state. They fall under the Airline Deregulation Act. Currently, there's a bill filed in the U.S. Congress that would give states the power to regulate air ambulance industry. But so far, it's been stalled in committee. Robert and Leslie?